Good evening, everybody. I'm going to be on with Professor Charles Kingsland this evening. So hopefully he will be joining me very soon. And we are going to be talking about endometriosis, as it is Endometriosis Week. And we have had lots and lots and lots of questions. I just hope that we can get through them all for you. But if not, I'm sure that we'll do something else as well. So I'm just waiting for Charles to join me, and then we can get going with all of the questions. Right, Charles, if you're watching, this is always the worst part. I can see that he's joined here, so he'll be joining me any minute now. Okay, connecting.
Here I am. Hi.
Well done. Well done.
Hi, Zita. That's really good. I did it first time all by myself.
Oh, did you? No little helpers?
Well, one little helper, actually. How are you, Zita?
I'm fine. How are you doing?
I'm fine, thank you. I'm fine. You know, the topic tonight, I don't know how we're going to get through it all in half an hour, because there's loads and loads of questions that we've had sent in already, and there's lots of I think there's lots of things to talk about, not only from the medical side but also from the nutritional side as well. So
well, I've said to people we'd do our best to get through, but maybe we'd have to do another repeat one to get through all of the questions.
Yeah, okay. So so let me just have a look. We've had a lot of questions, and of course the thing that we have to remember is that many women who come to our clinics for help for fertility have actually got endometriosis. So it's a depressingly common disorder, which seems to be increasing in prevalence. The more you look for it, certainly, when I was practicing general gynecology, it's a lot more common than you would think. I mean, we do many laparoscopies, and even in patients who are asymptomatic, if you look hard enough, at least 50% of younger women would have evidence of endometriosis. And the enigma about it as well, Zita, is that it doesn't necessarily follow that the more you've got, the more painful it is. I've seen people with very minor degrees of endometriosis who are really incapacitated with pain.
Yeah.
And then others who have got virtually a frozen pelvis full of endometriosis who are relatively asymptomatic.
It's interesting because we've had a late question in, which from a woman that's got silent endometriosis. She has no symptoms, but her RBC, red blood count, and white blood count are high. So how would she know she had silent endometriosis?
Well, the only way you can diagnose endometriosis is by laparoscopy, to actually see it. It's very difficult to see minor degrees of endometriosis on ultrasound scan. You can only see evidence of endometriosis if it's significant. So for example, if you've got endometriosis on your ovaries or in other parts of your pelvis where it's significantly large, you can see it on ultrasound scan. But otherwise, on laparoscopy, on ultrasound, it's most of the time it's invisible, and it's only when you actually put a telescope into the abdomen where you can see sometimes very tiny little what we call powder burns. It just looks like the top of a match, where tiny little deposits of endometriosis are in the pelvis, which of course you cannot see in ultrasound. So the only way you can really diagnose endometriosis is by having a formal laparoscopy. So I don't know whether this lady's had that.
I don't know, but it's interesting as well, because a lot of questions on the severity of endometriosis. And can you sort of explain the stages? Because there's stage 1 to 4, isn't there? Sort of mild to...
The thing about endometriosis is it's an enigma, and I'm one of the things that I say certainly to medical students when I'm teaching them about endometriosis is what you have to remember is that women are not necessarily designed to have periods. If you think about it, 100 years ago, women didn't have periods because they had their first period, they had their menarche, the first period when they were 18. Nowadays, it's much earlier due to nutrition, better health. We have our first period when we're about 11. But women 100 years ago had their first period when they were 18. They then had their first child when they were 19. The average age of a woman having her first child 100 years ago was 19. A woman then spent all of her life having babies, miscarrying, breastfeeding, miscarrying, having chronic anemia and tuberculosis. And her life expectancy 100 years ago was only 45. Now, nowadays, of course, one of the greatest innovations that ever befell women, and this was voted as the greatest medical breakthrough in the past 1,000 years, in the year 2000, the turn of the century, last century, was the ability for women to control their periods.
Yeah.
And as soon as you control your fertility, what happens? You get an equal standing in society, you get a vote, you get educated, and who knows, we might even have a female prime minister one day. But one thing that then happens is, because you are free from the, I know it sounds a bit analogous here, but when you're free from the fear of repeated pregnancy, your quality of life improves, but society expects more from you. And when society expects more from you, you have to delay something, which is your family. And that's why the average age of women having their first child nowadays is 31, 32. But the price that women have had to pay is that they now have periods because they're not pregnant all the time or breastfeeding. And so endometriosis was unheard of 100 years ago. But when you have periods, not only does menstruation flow downwards, there are times when it flows upwards, out through your fallopian tubes and into your pelvis. It then drops on other parts of your pelvis, and it grows its own blood supply, and then it becomes under the influence of your hormones. So that then when you have a period, those other parts of your body where the endometriosis has landed also bleed. And yeah. I've seen women who've had recurrent detached retinas.
What?
Well, do you know what? I'll tell you this story. I know it's not quite, but I in my finals going back 1,000 years when I was a medical student, my patient that I had to see was a 35-year-old woman who had recurrent collapsed lung. Every so often, her lung would collapse. She'd become acutely breathless. And I was presented with this 35-year-old lady, and I took a history, and the examiner came in, a guy looked like James Robinson Justice in those days with his white coat, and he asked me to take her to present the history. And this woman had regular collapsed lungs. And at the end, I took this beautiful history and explained everything. And the examiner said to me, when was this lady's last period? And I'd taken a history, I could tell you the name of the next door neighbour's parrot, but I didn't ask her when her period was. And so he asked her when her period was, and sure enough, she was in hospital with a collapsed lung at the same time as she'd had a period, and the time before, And what she had was endometriosis of the lung. And every time she had a period, she bled into her lung.
Yeah.
Collapsed. And I've seen women who've had endometriosis on their retina. And when they have a period, they go blind.
Gosh.
So it's a terrible disorder, but it's a disorder of the 20th century. Yeah. Because years ago, women didn't have periods. And so that's why we tend to not be, I spent in the 1980s, I spent half an hour learning about endometriosis. I spent 3 months learning about tuberculosis, and I don't see tuberculosis.
Well, I mean, I've learned a lot about endometriosis through clients over the years, but I think as well that part of this has to be diet. It has to be
Oh,
environmental
definitely.
in terms of why women are getting are getting endometriosis. And like with my holistic hat on, I think there's a lot you can do through diet, through supplements, through nutrition. And also, there are additional things that happen to women with endometriosis: irritable bowel syndrome, constipation, diarrhea, but also their quality of life, because the pain they go through is really, really knocked back, isn't it? So mental health becomes an issue as well.
Yeah, and often the treatment of and talking about the, the 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 girls that come across our path, it's either in gynecology, endometriosis, we're trying to manage pain,
Yeah.
or infertility, we're trying to manage the fertility problems. And this enigma, which is endometriosis, often the the girls with the worst pain have the mildest endometriosis. And I've seen women who have had no pain whatsoever, and their pelvises are frozen with endometriosis. But similarly, often you will have minimal endometriosis, which causes the most significant fertility problems. So it can't be just a mechanical thing. There has to be some association between endometriosis and infertility. So if you've got, and it's very, very common, but obviously if endometriosis is blocking or is on your ovaries, it's going to reduce your egg count. But often you'll have nothing except a few little powder burns in your pelvis, and yet you will have difficulty in conceiving. But you're absolutely right. When and you can tell us all about this. Not only do we have to medically address the problems of pain and fertility associated with endometriosis, but also dietary. And the one thing that we would always advocate is omega-3. There used to be a lot of information. But just tell us a bit about lifestyle and endometriosis.
I think that's what's hard for women, because they will go along to their doctor or their gynecologist or their fertility doctor and ask about diet and nutrition, and very often they're told, well, there's nothing you can do, you just got it, it's painful, the best thing that can happen for you is to take the pill and get pregnant. Not to take the pill to stop the pain, but getting pregnant is going to stop it. And I think there needs to be more education in terms of IVF clinics, etc., to help a lot of these women prior to going down an IVF route. And so one of the questions we just had here, which is quite interesting, is it worth doing tests to check if I have endometriosis? I have many symptoms before starting my IVF cycle. So women are worrying if they get any pain, period pain, that it might be endometriosis.
That's right. But the thing is, one of the fallacies is that treatment of endometriosis doesn't necessarily improve your prognosis of a pregnancy. Obviously, if you've got big cysts on your ovaries due to endometriosis, then then it may be important or worth your while to have that removed. But generally speaking, treatment of endometriosis does not improve your chance of getting pregnant. But obviously, treatment for pain is essential.
Yeah.
The anathema of infertility, of course, of endometriosis, is that the best treatment for endometriosis is to stop your periods.
Yes.
Either by taking the oral contraceptive pill, or pregnancy.
Yeah.
Or breastfeeding. All these things will reduce. And I've seen patients with terrible endometriosis be cured when they get pregnant. So in answer to the first question, can I conceive with endometriosis? Of course you can. Of course you can. But if you think you have endometriosis and you have a fertility problem, it's worthwhile getting expert advice quickly. But that doesn't mean to say that you can't adjust your lifestyle to accommodate or to try and treat yourself. Omega-3, stress as well. What would you say about stress and
Oh, I think
endometriosis?
stress, you know, it is stressful. If you're in pain, you're debilitated, it absolutely wears you down. It's stressful doing IVF. You've got cortisol and adrenaline streaming around the body. So anything that you can do to help that. But then it's no good telling a woman to do that when she's in a lot of pain. So I think
Yeah.
the way we look at it at the Zita West Clinic, we would send them for nutrition and really put them on an anti-inflammatory diet, because I don't know what you think, Charles, but inflammation is the road to everything, isn't it? In sort of chronic disease. And so
Yeah.
when you've got inflammation in the body, it's a driver for the pain with endometriosis. So, you know, really looking at their diet, cutting out wheat, cutting out alcohol, caffeine, trying to dampen down the immune response. So like you were saying, omega-3 is really important, vitamin D is really important. And again, you know, there are some studies to show now with the gut and the microbiome that this can have an impact. So probiotics are a really good thing. And, you know, it's plenty of water. I know that this is a really basic thing to say, but you can take as much green vegetables, supplements as you like, but if you're not drinking water, and I know for me, I find it hard to drink water in the winter, but water hydrates you, it helps with the constipation, it helps with the bloating, and it can help with the pain. So, you know, I think you need to look holistically at your endometriosis and do what you can in preparation in the lead up to IVF.
Well, you know, Zita, I'm becoming increasingly a disciple and advocate of your your statements and your mission, because I think with endometriosis, you're absolutely right. Preparation. If you're coming into, you know, trying for a baby, or you need or treatment, and you have a diagnosis of endometriosis, you know, like any athlete would prepare for a race or whatever they were participating in, you've got to prepare yourself for pregnancy, particularly when you have something like endometriosis, which we know may be associated with difficulty in conceiving. So all these things that you suggest, I advocate very strongly. I think
You still haven't been down to have acupuncture with me or hypnotherapy, Charles, though, have you?
well, I've
It's
just had
nearly a year now.
I've just had I've just had my second vaccination, so I can travel. I've got my
All right.
passport, so they'll allow me on the Northwest Rail. So I'll be down. But you're right.
I look forward to sticking some of the needles in the fertility points that we use.
I might be a bit old for that now, but no, I'll let you try. So
Okay.
so can we just answer some of these questions?
Yeah.
I conceive with endometriosis. Yes, of course you can. If you've got a known diagnosis of endometriosis, though, seek help early. Seek help from people you can trust, and get that information and get a plan together. And similarly, if you one of the anathemas of endometriosis, and it is a really unpleasant disease to have, is that often the treatment of the pain is contraceptive, and so we're always striking this balance between pain control and fertility. But of course, if we can achieve a pregnancy, and many women do with endometriosis, it's what we do after all. Jobs are good, because then you've got 9 months of treatment of endometriosis, and then if you breastfeed, you've got another 18 months. And who knows? I remember one girl who was absolutely debilitated. I remember her quite clearly, because she was so ill. She was almost bedbound with endometriosis. And we managed to get her pregnant on her first go at IVF with twins, and it cured her. And it was miraculous. But so never ever give up hope for the treatment of endometriosis. If you are having difficulty finding help, there are designated endometriosis centres, and of course this is endometriosis week, or is it next week? Well, it's one of the two.
No, it's the endometriosis month.
Endometriosis month.
Oh.
We're very lucky in Liverpool, because we have a fabulous endometriosis clinic in Arrow Park Hospital with designated endometriosis gynecologists, and they provide a brilliant service for us, for our fertility units. But there are designated clinics So if you do have a particular problem, then seek out a specialist endometriosis centre, and of course, Care Fertility for your fertility problems.
I've got a question here about pain. Is there anything I can do to help the pain for myself? Any sorts of things I can do? And I think there are, but you know, the pain is more severe in some women than others, and different things work for different women. But I can say over my time, the things that have helped women have been things like abdominal massage. And it's quite interesting because women very often, when they've got pain, they don't want to associate with this whole area, the lower abdomen. But if you can sort of like massage it, it helps alleviate some of the pain, because you know you're helping to you get tense when you are in pain. So I think that's worth doing. Abdominal massage. Sometimes a TENS machine can be quite useful. A TENS machine is what we use in labour, but there are specific ones now for period pain, so that's worth trying. And recently there's been some studies, small studies, on CBT oil as an analgesic because of the THC component of it. So I think all of these things are worth trying, don't you?
Yeah, absolutely. And then if you need to, if the holistic methods are not effective, then you can suppress menstruation by taking the oral contraceptive pill continuously, because if you suppress menstruation, you're going to reduce the incidence of endometriosis. I know there are exceptions, and I know there are, and there have been cases where endometriosis has been found in women who have been born without a uterus, but they're very, very rare. But if you suppress menstruation, then you will should relieve the pain. You should be able to relieve it significantly. And if you don't want to use hormonal methods, there are plenty of others. Anti-inflammatories are very effective, but you need advice. And again, the enigma of endometriosis, you might have the most minor degree of endometriosis, stage 1, and that can cause debilitating pain. And you can have stage 4, which affects not only your pelvis but also distant organs like your eye, as I mentioned before, with or your lung or your bowel. Some people will have bleeding per rectum, and they're pain-free. So that's the enigma. So don't ever feel that just because you've got minor endometriosis you should have minor amounts of pain. You can have significant pain, and nobody should be in pain, because pain exacerbates your fertility problem. So you need to get adequate pain control.
I think as well it's worth trying alongside the medical side things like acupuncture, things like hypnotherapy. All of these things can be useful. There's another couple of questions here. Is long-term down regulation best ahead of a FET if you have endometriosis, or is this only for severe cases?
No, it's not any better. It may be of help if you've got severe pain, but you don't need a long down regulation. That will not increase your chance of getting pregnant with a frozen embryo replacement cycle. How would I know that I have endometriosis? Well, the only way you can find out definitively is by a laparoscopy. Could you have endometriosis without any symptoms? I've seen patients with significant endometriosis all over their pelvis with no symptoms whatsoever. And if you do cesarean sections, as I used to do, many times you'll be doing a cesarean section on an asymptomatic woman. You'll open the abdomen and there will be endometriosis, and the girl will have never had any symptoms whatsoever. So you can find it all over. But there is that association between endometriosis and subfertility, that difficulty to conceive. What is the best way to get diagnosed? Laparoscopy. I was suspected to have endo whilst going through fertility treatment, but my partner has now got a low sperm count. I got ignored, and so we got ICSI. Well, actually, the thing about it is that treatment of endometriosis doesn't necessarily increase your chance of getting pregnant. Obviously, as I said before, if you've got big cysts or endometriosis that's blocking your fallopian tube, for example, then you need it removing. But generally speaking, treatment does not improve your chance of having a baby. If you've got endometriosis and you have pain, then get your pain sorted. But if you've got endometriosis, you want a baby, get referred to a fertility unit, because going to see an endometriosis surgeon first will not necessarily help you, and might just delay your chance of getting pregnant. And of course, whilst you delay getting pregnant, your fertility will naturally go down anyway.
Another question here, Charles. When after a laparoscopy removal of a right ovarian cyst and subsequent decrease of AMH under 1, it's hard to think, IVF take place. My doctor is hurrying me as my low AMH and my follicle count of 5. When is best to start IVF?
Well,
so
for you,
she's had the laparoscopy, she's had the removal of the cyst.
Right. Well, you need time to recover. So I would say 4 to 6 weeks to get over your, obviously if you're in pain you need to take longer, but when you feel generally well, then you should pay a visit to your fertility doctor. Normally I would say 4 to 6 weeks should be don't hang around, in other words. Okay. Get to see your fertility doctor. Is there anything you can do to remove endometriosis? Can you get rid of it completely? Yes, there's lots of things you can do to get rid of endometriosis that we've said before. Can you get rid of it completely? You can never get rid of it completely, but you can get rid of the vast majority of it, because a lot of endometriosis is microscopic, so you can't even see it, even with special operating equipment. So, but you can control it. Endometriosis can be controlled. How can lifestyle factors improve my endometriosis or possibly my chance of success? Here's one for you, Zita.
Well, I've talked a lot about what you can do, but I think there are many factors to take into account, and there's a lot of information out there on anti-inflammatory diets, etc. So I think as a rule of thumb, things like avoiding trans fats, cutting down on red meat, eating plenty of fruit and veg, limit caffeine and alcohol, cut down on processed food. Some women find giving up gluten and wheat in their diet is a good thing. So look at everything you can do, because, inflammation is a driver here for endometriosis. So anything you can do to help with that is good. And like I said, omega-3, vitamin D, probiotics will also be helpful as well.
Okay. Endometriosis impacting chance of natural fertility. Does endometriosis affect your chance of naturally becoming pregnant? Yes, it can do. It can do, but as I said before, I've seen plenty of women having babies who've had coincidental endometriosis. Endometriosis is far commoner than you think, but there is an association between difficulty conceiving and endometriosis. Can minimal endometriosis affect your fertility? Yes, it can. And I've seen the most minimal of endometriosis cause the biggest difficulties, and vice versa. And that's why it's such a very difficult and unpleasant disorder to have in many, many circumstances. How much of an impact should the different stages of endometriosis have on fertility? I'm stage 2. Stage 2, a little bit, but not a lot. I don't think we've got time to go into all the different stages, but we could always do that on another time. Does endometriosis affect egg quality? Yes, it can do, especially if you've got endometriosis of your ovary, but there will always be eggs in there that have been unaffected, so get seen quickly. Are you more likely to miscarry if you have endometriosis? No. Fertility treatments and endometriosis, thinking about IVF stage 2 endo, how would my treatment be different to a normal patient? No different. As I say, endometriosis is very common, so it wouldn't necessarily mean that your treatment would be any different. It's just that if you have fertility and you have stage 2 endometriosis, then we need to get you seen as quickly. How do you prevent endometriosis returning when waiting for IVF? Go on the pill. Take the pill continuously, stop yourself having periods, or seek advice from your own gynecologist, or your holistic therapist if they're of help to you. Is there anything that you would add, Zita, about?
No, I think I think the diet, I think lifestyle, I think mindset, all of these are, really, really important in preparation for IVF if you have endometriosis.
Okay. Oh gosh, we've got lots here. We'll do another 5 minutes. I have endometriosis. Would it be straight to IVF or try Clomid first? Depends. Not necessarily straight to IVF. It depends on the extent of the endometriosis, your age. Obviously, if you're over 35, you have endometriosis, you've been trying for a baby, then you need to seek advice earlier than normal. If you have endometriosis and you want a baby, I would seek advice virtually straight away. You don't need to wait. Just get advice. What is usually used for endometriosis? Short or long protocol? Doesn't matter. We use short. Doesn't make any difference. Endo impacting chance of fertility treatments. What's the success rate with going on Clomid if you have endo? Can be quite good. Depends whether you're releasing an egg or not. If you're not releasing an egg, then Clomid is good. If you are releasing an egg, then Clomid will not improve your chance of getting pregnant. If you're ovulating, Clomid does not help. Chances of IVF success after stage 4. Well, your local fertility doctor will tell you about that. It depends on whether the stage 4 has affected your ovaries or affected your egg quality. But some simple tests will tell you and will give you an idea of what your chances are of achieving a pregnancy. But there again, endometriosis is only one of a whole load of factors: age, weight, your ovarian reserve, your state of general health, all these things which have to be taken into account. You can't take endometriosis by itself. You need to take the whole picture, and that's why you need to seek advice early, so you've got a clear idea of what you need to do to give you the best chance of getting pregnant. And and that involves holistic therapy, looking at your general lifestyle, diet, and all the things that Zita's such an expert at. Is there anything you'd want to add to that?
No. I think that is right.
Okay. Right. General fertility questions. Why do most consultants advise against transferring 2 embryos? Because the human female is designed to have lots of babies, but one at a time. Okay. Years ago, we used to put back lots of embryos because we couldn't freeze embryos successfully. So we only had we had created the fresh ones, and the chance of getting pregnant with frozen ones was not as good. Nowadays, we've got lots and lots of new protocols, which means that frozen embryos give you as good if not better chance of getting pregnant than fresh ones. The problem is, though, if you put 2 embryos back, it gives you a better chance of having a pregnancy, but it gives you a lower chance of having a baby. Because if you conceive with twins, we all see the lovely, happy twins that are being pushed around supermarkets, but you don't see the ones that have miscarried or been born prematurely or been born with health problems. So you are 5 times more likely to miscarry twins than you are with singletons. So remember that. Have as many babies as we possibly can, but 1 at a time. 2 at a push, not 3, never 4. Okay. After IVF is done and pregnancy is confirmed, when can you go back to exercising and sex? Well, I'd wait till you get home, actually. What would you say about that?
Well, I have a different view on that. I think that when women have gone through IVF and they get pregnant, they are so stressed. They're so happy, but they know nothing about pregnancy. They know everything about fertility. So I think they should wrap themselves in cotton wool. I don't think they should go back to exercising. Gentle exercising is absolutely fine. And I don't think they should be having sex until at least 9-10 weeks. But there's no evidence for what I'm saying, but I just think intuitively that's what women feel.
Yeah, I think, you're absolutely right. It's what's best for you. I don't think there's any, the French IVF doctors would say straight after embryo transfer, you should have sexual intercourse because the genes in the sperm sort of help to, well, they say that it helps implantation if the embryo recognizes sperm in the vagina afterwards. So they would advocate sexual intercourse after embryo transfer. I don't think in Britain we would go that far, but Zita's right. If it's comfortable, do it. I've seen an international squash player asked me whether she could play an international squash match straight after her embryo transfer, and that I think is a bit silly.
No, it is. It's too much. But yeah. I think we should end here, Charles, and we should do another session for some of the remaining questions. But you really tore through the last lot, so that was great. We've answered quite a few.
I've got about 100 here.
Yeah, but yeah, no, thanks so much. And,
not at all, Zita.
For anybody watching this, this will be on this clinic site and on Care as well. And I think we've got a date for another evening, haven't we?
Yes, we have. We
yeah,
have.
Yeah.
And we'll probably catch up with me. I'm sorry, I've got endometriosis is such a big subject very close to my heart, and it crosses both the holistic and the medical. It's a classic, isn't it, Peter, that we should take this sort of multiplicity of approaches towards managing endometriosis, because it can be complex, but there is a solution. Yeah.
Okay, so bye, Charles. I'll see you soon, and thank you for everybody that's listening. And I hope that helped you in some way, and it will be on our IGTVs. Thank you. Bye bye.
Thanks, Zita. Bye.
Bye bye.
Bye.